Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. Today we wanted to address low back pain or acute low back pain. Usually it starts out with just a little bit of a soreness a day or two before, and you want to put ice on it right away because sometimes you can avoid having a more severe episode. If not, sometimes you'll be bending forward to pick up a pencil, or you'll just wake up with a really sore back, which affects your function. Usually bending forward, side movements are all restricted and can have pain either in the back here, right across the low back, or even down the leg. So the first thing we want to address is putting ice on it. Okay, we put 10 to 15 minutes on and about an hour off. We also put a back brace on. So if you have a back brace, you want something that goes around the back and compresses the back to keep that stability in there. In the office, we often tape it, but since you don't have that, we want to put the back brace on, and we leave it on for a while until basically you're 50% better or 50% less pain. And then you can take it off, but you want to have it on while you're doing movements or exercise. All right. Another thing that we want to make sure that we're doing is we're not sitting in low chairs. So something along the lines over here, if I'm sitting down here, my knees are higher than my hips, obviously you're putting more pressure on the back because the back is actually bending and putting it on more pressure on the discs. All right, so we want to sit on things that are higher up, usually more of a stiff seat, and couches are probably a bad idea at this point as well. So try to stay with your knees, hips above the knees, all right, something that's higher up, like a stool, a chair. Okay, so after we address that, we want to think about an exercise that might be able to do. So we often do pelvic tilts. Okay, so pelvic tilts, basically where you're laying on your back, your knees are up. I often put my hands underneath kind of the bumps in your back here or underneath your butt, and I'm tractioning down because you want to get that traction that helps alleviate the compression in the back and on the discs. And I'm laying down. I'm kind of thinking about my head going this way and my butt going that way. So I'm tractioning out that spine, and my arch of my back's here, and I'm flattening it against the floor. And I'm holding it there for about 10 seconds. Then I relax, and then I push it back down again. This is usually during a lot of pain. You want to relieve that pain. Usually helps relax the back and gets that little bit of stretch, because stretching does feel good. Sleeping wise, all right? For sleeping wise, we want to make sure that we're laying down and getting into a comfortable position. Sometimes it's really hard to be in a bed and get a comfortable position just because maybe your bed's a little bit too saggy, or the memory foam is just kind of too comfortable where you're kind of sagging with your hips or on your shoulders, the heavy parts of your body. So sometimes you can try a recliner. It can work really well. Just get that comfort, because if you're not sleeping, you're basically not healing, and usually the pain lasts longer and you're in more pain. Okay. Some of the other symptoms that we come across too is if you're coughing or sneezing can increase the back pain. Usually in the morning it's worse, and even bowel movements can sometimes cause this back pain to happen. Okay, I hope some of these hints were really good for you. Remember your ice, your pelvic tilts, your back brace, and getting in a comfortable position to sleep. Those are all very important. Take care and have a nice day.